But we did get a bit of good news, as much as we are stuck at home on account of COVID-19, and that is that the 10 Kenyans who've recovered from the COVID-19 virus testing negative, bringing the number of those who've recovered in the country to 22. There is another gentleman who will be joining us shortly, and his name is Steve Kinothia. He is admitted at the St. Louis Hospital in Paris, France. But don't fret, he is feeling much better. First, let's take a look at how he was feeling on April the 2nd when he was admitted to the ICU.
They used to say Africans are contracted. That's stupidity. Hii kitu inamaliza hata Waafrika, inamaliza wazee, inamaliza matajiri, inamaliza maskini, inamaliza ngozi nyeupe, nyeusi, rangi yote, age yote. Kwa hivyo ile kitu nawaambia, take precautions. Msiseme serikali sijui inatufungia.
Stephen, good to see that you're looking, and you tell me feeling much better. You're even sitting up on your hospital bed. You tell me you're out of the ICU and now you're recovering. Okay, how different do you feel now compared to when you shot that video a couple of days ago?
Yeah, thank you very much just for inviting me for this interview. And just for knowledge, my name is Stephen Kinothia. I'm in Paris. I'm a Kenyan residing in Europe and working in Europe. I want to share my experience because I was sick on 23rd. I started feeling nausea and some headache, some learning stomach, some chest pain. And I went to see my doctor on the 27th, who really told me that I have the coronavirus. In the first place, I didn't feel any shock because I was so painful. My body was so painful. And he gave me some medication, some antibiotics, azithromycin, for 3 days. I took those azithromycin for 3 days, but unfortunately, they were not doing any good in my body. So I had to call him on second just to give him information. And he told me not to go to his cabinet, to his office, and to go direct and see for a scanner. And in fact, he sent the prescription direct by email.
Okay.
When I went to do the scanner, my lungs were rotten. I can say that. Because immediately I was transferred to St. Louis Hospital in Paris in an ICU unit. And you know, when you hear in Europe, when you are declared COVID-19 victim, you don't see your family. It's like you are isolated, and they remove your clothes. You are traumatized. I was traumatized, but I had a lot of pain.
Sorry to hear that, Stephen, but I'm sure you've been sick before. How different was this particular experience? I know you've talked a lot in your videos about having a fighting spirit. How different was this sickness?
This is a different fight because I saw death. I was in the tunnel of pain, darkness of death, because I could see myself walking in front, and my people I loved very much were behind me and they could not reach me. So I saw death. In fact, God saved me in the middle of the tunnel. And that's the difference between who Kinothia was yesterday before the virus, the coronavirus, and Kinothia of today. And in fact, I want to just to say that night of second, when I saw that tunnel, I was in that tunnel. The following morning when I woke up, I decided to take that video, which I sent to a friend and I sent to social media, because I said, since I'm dying, I was dying, and I knew I was dying. I was already dead.
Well, Steve,
I wanted to share my experience with Kenyans, telling them that this is not a joke.
All right, thank you so much, Steve. And I'm glad you're looking and you're feeling like a new man. Do tell us, a lot of ado has been made about oxygen. When we saw that video you shot on the 2nd, you were hooked up to oxygen. How has that benefited your recovery? You know, because the government has time and again asked those who are hoarding oxygen cylinders to release them. What difference did it make to your recovery?
You know what happened after, even if I'm healed, my 2 lungs were damaged. So for them to recuperate, I have to have this oxygen. I sleep with oxygen, which is about 4 liters or 4 liters of oxygen. It's just to help. Even if I'm not contagious, I cannot affect people, or I cannot be affected anymore. But my lungs need some oxygen for it to recuperate the damage.
All right. Stephen, finally, the reason you said you shot that video was to speak to Kenyans, inform them, let them know how serious this COVID-19 situation. What message do you want to leave them with?
In fact, I saw what happened in Mombasa at the ferry. I have heard that there are some manifestation in Githurai. What I can tell Kenyans, in these European countries, we ignored China. We say there's a Chinese disease. So we didn't do anything. We ignored everything. Italy, they started street battle in the street like what we are doing in Nairobi. The same thing. In Spain, the same thing. But today, they are crying for their death. I can tell Kenyans that in Europe, we don't ballet anymore. We ban people. And the people is the military who are doing the job, because when your relative is dead, you cannot do anything with that body. So let us not reach there. Let us ask the government to make a lock-on completely in the country. This country is in Europe. All the countries in Europe, including France, we are 4 weeks ahead that it has been locked out the whole country. Even transporting the sick people from east to west, north to south, is the military aircraft which are using that. Okay. Moving from your house to go to the supermarket, you have to have a form that I'm going to see the doctor, I'm going to buy something. Okay. You cannot move from one place to another. Okay. The other thing is that we have to intensify the control. And that's why I'm asking the government to be serious on this lock-on. It should not be only in Nairobi and the Coast Region. It should be the whole country. Okay. It's painful, but it's the price to pay. Otherwise, we will be our people will be dying in the street. You will not even be able to bury or even to ban them. The other thing, and the last point before I wind up, our politicians are using this as a joke. I saw some politicians selling. Giving buckets with some blooding, or some are giving some shampoo. Shampoo will not help kill coronavirus.
COVID-19. All right. Thank you. Understandably, yes. Steve has so much to tell us, given he says he's a man who's come back from the brink of death. And I'm so sorry, we do have to take a break. But Steve, one last question that Mark Masai had for you. Are you afraid of experiencing stigma? You're scheduled to be released on Tuesday. The government here said those who are being released should not be shunned by their society. Are you afraid when you go back home that perhaps your neighbors might look at you a little funny?
Yeah, I'm a different Stephen today, and by message, and I'll pray God that when I come out of this hospital, I'll try to find positive-minded people, because a lot of people who are confined in their houses, they have nothing to eat, they have nothing to even to drink. And we have a lot of destitute people who are very poor. Okay, Steve, I know that you got my question. I'm asking, are you afraid that people may shun you or keep their distance because they're afraid of getting infected now that they know you are positive? The distance, we need to keep distance, but keeping distance is also telling people that when you go to look for that kibarua and you get the 300 Kenya shillings, you are taking the virus home. Okay. Let us even not be close to one another. All right. Okay. Let us stay wherever we are. I heard people saying that we are going to pray God over the weekend. That is total nonsense. Thank you, because Steve. People who are passing through the bus to get some beers, you take the virus from the bar to your home and you kill your children and your family. All right. Thank you, Steve. And that is from a man who has experienced just what COVID-19 is all about.